Okay, sorry, there were more people joining, so I needed to let them in. I'll reintroduce myself. Again, I'm Devon Whitmore. I'm the community advocate here with this organization, Deaf Inc. I've been working here for the last 2 years. I've been working in community services for 16 years total. Right now, I'd like to share information with you that you can use at home, maybe or not. I'm sharing it today because maybe something will change tomorrow. There's many things that apply to some of our COVID experiences for the last 10 months and soon to become a year. So I hope you enjoy this workshop and it meets your expectations. So a little bit of housekeeping. Hang on, there's just a few more people joining and needing to be let into the workshop. Okay. Okay. Like I said, a few things that I want to touch on as far as housekeeping goes. If you're not experienced with Zoom and you haven't used it, these are just a few things to help you out. If you're using your computer, iPhone, iPad, these are just basic setup for like a computer, laptop, that you can stretch my PowerPoint so that you can see it on one side. You can see the interpreter and the PowerPoint side by side if you put it in this view, side by side mode. And then if you choose speaker mode, speaker view, you don't have to, that's up to you. And then for the remainder, I'd like you all to shut your cameras off while the interpreter is voicing. It'll just go more smoothly. And then at the very end, we'll be able to turn cameras back on again if we want to ask questions and you want to sign for yourself. And so we can see each other at the end for that. Can you guys turn your cameras off, please? Oh, I can do it. Okay. Okay, so during the presentation, if you think of any questions, just go ahead and type them in the chat box. And then at the end, we'll try to make sure we answer all those questions at the end, like I said. So I know some of you are hearing people and some are deaf. It's a mix. And some of you will already know the answers to some of these questions. So I know you're thinking, why is this training, this workshop important, for deaf and hard of hearing people in this workshop? Does anyone want to comment on the question I just asked? Okay, so I'm going to go ahead, see if we're close or not. So deaf and hard of hearing people, many people don't realize, like myself, I don't have a hearing aid. I don't have anything to indicate. There's nothing to show around you that, or nothing around me to show you that I'm deaf. So, especially with COVID, I mean, the importance is being quick, safe, being able to communicate with deaf and hard of hearing. Not only during interactions, but also just to be aware out in the community, health, be aware of individuals so you can avoid exposure, continue to be safe, reduce the spread, especially if you're in the medical field for communication purposes. Now they're starting vaccinations. So we'd like to make sure that everyone's ready and they know what to do for the deaf community when it comes time to give them their vaccinations, how they're going to communicate with them. Some deaf, hard of hearing, are familiar, or some people are familiar with the deaf and hard of hearing community and some are not. They're actually pretty clueless with it. So there are different types of identities of deaf. Small d deaf, or they grew up deaf, but they never really necessarily identified as deaf. They never really socialized or were culturally deaf. Capital D deaf means they're proud to be deaf. They identify as deaf. Their first language was ASL. They're culturally deaf. Hard of hearing just means that they have some hearing loss. It could be on any range of a continuum, and they struggle with some hearing loss. There's nobody that's really at the same level of hearing loss. And it could be in each ear, it could be in just one ear. For example, my mom has some hearing loss in her right ear, but her left ear, she can hear perfectly fine. So do we label her hearing or do we label her hard of hearing? But she labels herself hearing. So if you're talking to her in her right ear, she can't hear you though. But if you talk to her in her left, she can. So As far as late deafened, it means that somebody is like was above 18 or later and they started losing their hearing. Typically, those people don't know sign language. It's very awkward for them when they become, when they start to have hearing loss because they have difficulty communicating. And then there are other variations. Completely deaf, maybe have a little bit of loss of sight, like Usher syndrome, where it's a type of like tunnel vision. They have a very narrow area that they can see. They can't see some of their peripheral vision, or they can't see above a certain area. It's typically in a specific little box area around their face, a little frame around that area. And then there's also people who are fully blind. Some of these people with the Usher syndrome can drive and some can't. And then there's some people that are completely blind and aren't completely deaf. Like I mentioned earlier, they may have started losing their hearing at a later age. And then there's some people who can see just a little bit. They may not be completely blind. So there's other variations of those two things that exist comorbidly. So there's many things with other disabilities as well. Cerebral palsy and deafness. I mean, there's just a huge variety of different disabilities. You know, hearing people have disabilities, and the same thing, those different disabilities can show up in deaf people as well.
So now I'd like to discuss how the deaf and hard of hearing community has been impacted by COVID-19. Obviously, it's very much impacted the hearing community, of course. We can all tell that now it's difficult for most of us to communicate because of everybody wearing the mask. And sometimes it's hard to tell people's facial expressions because half their face is now covered up. And if a person depends on lip reading, then that's gone too because the mask is there. And it's often very hard to hear because now your voices are all muffled. And it's hard to have the visual clues because, like I said, the environment is completely different. You go into a familiar space and you don't exactly know what's going on like you used to. So some people may be able to point to sort of communicate that way. But a lot of the techniques that we used to have are now different. And also the social distancing that we're all supposed to be following, that also increases the background noise that may be there because now there's more distance between you and the person you're talking to. And that can also, like I said, increase how hard it is to hear the other person because they're farther away. I'm sure you've all experienced some of these. Oh, excuse me. Just 1 second. I think there's more people coming in. So this slide is pretty self-explanatory. So the ADA always applies, but we know if the medical facility, maybe they're very overwhelmed, or maybe they just may not be able to accurately accommodate your specific communication needs. And it's just good to go ahead and keep that in the back of your mind as, you know, hard of hearing or deaf individuals, that yes, they want to be able to accommodate you however possible, but that may not just be applicable at the time. And there are various ways to contact the hospital ahead of time. That may be a good idea to see what communication accommodations you may need or they may have. I have a few suggestions to sort of make do for the accommodations that you may not have. And they're really very simple things that you can do. There's really no reason not to be able to do any of these things. The first communication suggestion is gestures. You don't need any special equipment for it, just, some arms and hands. And I'll elaborate some more on the gestures later, but in general, just use some gestures. Like right now, just sort of take that time and think, what random little gestures can I use instead of maybe full-on sign language? So maybe if you like, go ahead and type out some things in the comments maybe. Just in general, what gestures do you use that you have noticed maybe like in a hospital situation or a medical environment, you think that might be a good thing to use? Anyway, next up is using a whiteboard. It can be a big one, it can be a little one. It can be like in patients' rooms, hospitals will have that big old whiteboard in the corner. You may just want to bring one with you and just have one ready to go if you need to write a note to someone. Up next is the tablet or a smartphone, like an iPhone, something like that. Most people have some sort of a smartphone, and even if you don't, that's all right. But you can go ahead and make a whole lot of uses just from that simple technology. And of course, pen and paper. I'm sure hospitals have, any sort of doctor's office or clinic, they all have pens and papers, right? So there's no reason why you shouldn't be able to use that. And maybe if a deaf or hard of hearing person doesn't have a tablet or some sort of a smartphone technology, maybe just keep a little notebook with them or a little piece of paper or something like that. And if they ever need any note sharing back and forth, they can just sort of hold on to that if they need it. So now I'm curious, you guys have had some time, so what do you think some good gestures you all could use are? Have you all thought of any? All right. So obviously we have sign language, but we also have gesturing, and they are two very different styles. Sign language is itself a legitimate language, but gestures don't have a specific rule set in mind. So now I just want to focus on the specific gestures that we can use during this pandemic and think about when we might be able to use them. So you can do this, just the beckoning hand, and say, come on, come with me. You can do the shrug your shoulders, I don't know, kind of face. And remember that you have a mask on now too. So if you need to, do the face, that might not be as effective. So you put your hands up and kind of add to it. You can kind of do sorry, it's kind of the same thing. Just, it kind of looks like, I don't know, and sorry, they kind of look similar, like kind of apologetic. Yes, just nod your head, shake your head for now. You can kind of do the crossing your neck out motion. If the shelf is empty, we don't have it. Like for any a vaccination scenario, let's say maybe they don't have the vaccines, and then they say, okay, come back next, say like tomorrow. That might just be something that is easy to keep in the back of your mind. Say time is out, it's over, it's cut off, no more. Something like that. You could do a little bit of basic sign language and do doors closing for closed. Anyway, everybody knows time, just point to your wrist. You can gesture up if somebody's mask is not covering their nose like it should be. Do a little Germ-X motion, just like some Lysol spray, like you're wiping off a table. Do a little Germ-X squirt in your hand, or the pump machines, rub your hands together. You can also sort of mimic using soap and water in the sink. Just put your hands up like you're saying, oh, just 1 minute, just 1 minute. Just wait, just wait. You can just point for this and that. You can point like this thing over there or that thing over there. Just a simple thumbs up. You can use the A-OK hand symbol for that. You can say, oh, are you okay? You okay? For this one, you can ask somebody, do you write with this hand or do you write with this other hand? You know, like for example, whenever you are getting the vaccine or any vaccine, they may ask, okay, you write with your right hand, so you might want to get the shot in your left hand so it's not sore. This is something that's important to keep in the back of your mind as well. Whenever you are setting up the physical area that you are in, make sure that your Wi-Fi is nice and strong. Maybe talk with your IT person and just make sure that you have little like hotspots sort of set up so that whenever the time comes, you can just move them and move along. Make sure you're aware of that, the deaf and hard of hearing people have the clearest access to your Wi-Fi. And for those of you that haven't heard, we have VRS, which is Video Relay Service. So the deaf and hard of hearing person will sign into the camera. They can be like from home, for example, or from work or whatnot. And they will call the hearing person. And there will be actually the interpreter that picks up. And it'll be sort of like we have here. I'm signing into the camera. The interpreter is voicing what I'm saying, that sort of deal. And that is provided through one specific company. It's funded by the FCC, the Federal Communications Commission. They have a specific budget and rule set for that. But that's not allowed to be used in the same room. That's sort of breaking one of their rules. So if you're sitting next to somebody, that's not an appropriate time for it. So for example, if your doctor wants to use it while you're in the room with them, that's not allowed. We also have video relay interpreting, VRI, or VI for short. They really just mean the same thing, VRI and VI. Typically, this will happen in like a business situation. They will make the call. And let's say like the hospital itself has a service. And VRI actually can be used in the same room for this time. So for example, it's like a last minute, it's like an emergency. I need an interpreter right this second. It may be like the live interpreter has been called and they're driving there, but the situation is really urgent. So we can't really afford to wait for the live interpreter. So that's when you could go ahead and use the VRI. But like I was saying, in the meantime, instead of waiting for the live interpreter, let's say there's like a huge outburst of the coronavirus and I can't wait for the live interpreter to arrive, we can go ahead and use VI or VRI. Communication access real-time translation, or CART for short. For those of you who don't know what that looks like, that's sort of like when the captions will show up on the screen sort of deal. So it'll happen on like a laptop or sometime on a different like a projector screen if you're at some sort of a large workshop, things like that. it could also just happen, like I said, on your personal laptop or something. So this is if a person does not use sign language, but they need to have English captions available. Zoom has captions available. That's for like a workshop like today, they have it. There's a variety of little situations where Zoom can have captioning. I've seen this used before and it seems to work pretty well. You can also do Zoom with a hired interpreter, which would mean like you would plan ahead of time. So the interpreter knows the medical terminology involved, or they know the specific point that's going to be used, all of your jargon specific to your business. And like I said, you already have them hired and ready. They know the best way to communicate your meanings. And then you can just go ahead and put them into the Zoom call.
You can have in-person live interpreters. In person, where a person comes to a facility to interpret. Let me clarify. They have many different interpreters. So American Sign Language interpreters, oral interpreters. I use American Sign Language myself, but not all deaf people sign. Some use oral interpreters where they only speak. Sometimes it's hard though, when somebody has a mustache or a beard. Cued speech interpreters. Some people are very well versed in cued speech. I'm not experienced with cued speech myself. I don't really know anything about it, but there are options. And the same thing that I mentioned just recently, CART, the real-time captioning, they will bring their own equipment and they will type. It's like a stenographer or a court reporter where they type in shorthand and then it shows up on a laptop or projected up onto a screen or some other device. And it would be separate from the laptop, maybe a standalone laptop. So now, as far as all this equipment is concerned, when you have in-person interpreters that are, you know, direct face-to-face providing services. So, you know, what do we have to do to provide safety? Do have clear masks. There are different styles. The first one is a clear mask. It might not fit everyone. It may not be the most comfortable, but it is really good to see through. It has great coverage. One negative is that it has a lot of space on the sides. So things could get inside possibly. The smile mask, that's the best name we have for it. It's pretty good. When you talk though, it does tend to move up and down as your lips move up and down. And it does tend to fog. The one thing we can suggest is use soap and water on it, and that seems to help, or an anti-fog, like a spray that you use on glasses or that type of thing. Again, when you're using that mask for any length of time, though, it's going to fog up, and then it makes it difficult to lip read. And then a face shield. That's self-explanatory. All three of them, just so you're aware, they are not FDA compliant for hospital staff. So they may or may not let you in with them. Some areas you can go in with them on, some areas you can't go in with them on. So in person, what kind of other equipment can you use? You could use your phone and your iPad, some type of tablet, and you can use different text apps. It's like your personal equipment that you already have. And something that I use all the time is Big. It's an Apple version. This is what it looks like. And you can place it either way, portrait or landscape. You have to set it up, with the sentences that you use frequently. When you're meeting people, you'll have those sentences already pre-programmed into it, and that way you can just show them to people. It's actually good though with the social distancing, the 6 feet apart. So it's good to have for that part of the COVID restrictions. And then big note for Android users, Android phones, that's something similar to Big for Apple. And then there are speech to text apps where you can actually speak into your phone and what you've spoken will show up as text onto the screen. Big can do that, the app I mentioned previously from the slide we just discussed. And another really good one, Otter. It has a limited number of minutes depending on which plan you choose. Basic, to the next level, to the next level. But you can pick out of several different plans. I mean, I'm very impressed with Otter, actually. Ava is the same concept. Each person, they speak on their own phone. And then they connect to each other. So I know who is speaking, and it shows all the turn taking when the text displays. Now there's something that will be the opposite of what we just talked about. Like I text and then into the app, and then the app actually speaks for me. It'll be, you can choose what gender voice to speak for you. I have obviously no idea what it sounds like, if it sounds like a computerized voice or an actual human's voice, but they are nice to have. And then there is an app called Mimics, where you speak into it, and then a person, it's not really a person, it's an animation that will produce signs. It's good for somebody who English is their first language. It's good for very short sentences. It's not for any kind of an extended conversation or lengthy discussion, or not for like to take the place of an interpreter. And it is something that you can use mobily, and it's portable. If you had a laptop, you could put it on there. So, or cart on your laptop. Or other fixed or semi-fixed equipment inside a facility. So what kind of things am I referring to in that situation? Like was mentioned earlier, VRI or VI, where the video remote interpreting, it'll tend to be on a stand with wheels, and it'll have just a little, what looks like a computer screen, and they can move it room to room. It'll be like a iPad or a laptop or some other little type of tablet screen. And it's adjustable typically. Next, they have public video relay service booths. They're not everywhere, and they're not just everyday things that you see, but typically in hospitals, they do have them. They'll have them like on the first floor. They may only be there because signals may not be the greatest at other places in the hospital. Sometimes they'll have public TTYs, teletypewriters. I don't know if those have phased out. Many people don't use those anymore. Those were the telecommunication devices for the deaf where you typed your conversation. But there are some people that still use them. They'll have like a regular, what looks like a regular old phone booth, and it'll have a teletypewriter at the bottom. So, and I mean, it's ready to go. It'll either be sitting there open, or they'll have a box, and you have to pay like quarters, you know, or coins, just like you would from an old phone booth. So, and then it would open the box, slide it out to you, and allow you to start typing. I think it's really important to emphasize and communicate the difference between quarantining and isolation during COVID-19. They seem to be similar, but I want to clarify and explain the actual difference between the two. So I actually have written an ASL sentence. If I signed it, this is what it would look like. So if you're near a person or a family member or a coworker, friend, and that person was positive for COVID, they could have possibly spread it. So you should stay home for 14 days from the last day that you saw or were in contact with that person. That is quarantining. And you want to stay healthy and monitor yourself. Make sure you're not sick. You don't get sick during those 14 days. On the opposite is isolation. So here is my ASL signed sentence that I would use for isolation. So if you yourself were tested COVID positive, you need to stay alone. Do not meet family, friends, coworkers, pets for 10 days and stay closed off to everyone. And you also need to keep that distance from other people. It's important for you to know as much as you can so you know what could possibly happen. It is definitely possible that an interpreter might be available, and there are several reasons why. It could be late hours, like into the middle of the night, and people are sleeping, and they call somebody and they're not awake, or, you know, maybe they've worked all day. It could be peak hours when times are really busy and everybody's working and there's just isn't anybody available. It could be that someone who is available lives an hour away, so distance is a factor. Always technology is a problem. Technology issues, it's great when it works, but you can't avoid technology issues. Oftentimes too, a patient or an employee is just not tech savvy. They're just not skilled when it comes to technology. They don't know what they're doing, or the hospital knows what they're doing, but the deaf individual doesn't, or the reverse. The deaf patient is all ready to go and knows, but the hospital staff is clueless. It happens both ways. A blackout or a brownout, no power at all, or power flickering on and off, laggy. If hospitals have that, it means their internet is like connecting, disconnecting, connecting, disconnecting. So for VRI, that interpreter, could be working at home, and it may be a situation that they are experiencing that in their area. It's also possible that a patient is trying to have a call or what have you during a peak hour, and internet traffic is very high, and so bandwidth is very low.
So these are just my suggestions going forward. Obviously, safety is first in all of these situations. Oftentimes people think, oh, I'm going to try to communicate with this deaf and hard of hearing person because I'm nice, and so they take their mask down to talk. And you really have to be aware that's an exposure risk, so maybe avoid doing that, because obviously safety is first above all else. And you can, if at the absolute last resort, if no other things are happening, maybe, but still do not lower your mask. It's the opposite of what we're trying to do. And it goes both ways for the medical person or for the deaf person. Just keep your mask on at all times. That's the #1 priority. So I was just talking about the various communication options, like we were writing down just pen and paper, the whiteboard, things like that, the gesturing that you can do, the various phone apps on your iPad or your iPhone and whatnot, those are obviously available too. The important thing is you can just go ahead and ask the deaf and hard of hearing person or your patient, what do you need from me? What would work best for you? Don't just assume that we're all the exact same and we all use the same accommodations, because we don't. Then they might just say, oh, it's fine, you don't need to do X, Y, and Z. Or they may say, oh, do you mind doing X, Y, and Z? I need to make sure everything's clear on my end. Sometimes it may feel rude, or it feels sort of like it's too much of like a responsibility on your part, but just go ahead and avoid any miscommunication and offer any of the options that you have available to you. For example, I tend to suggest things like just go ahead and ask the deaf and hard of hearing person, sort of like have if their response is just like nodding with sort of a blank stare, you can just be like, okay, well, what exactly are you doing today? And if they have sort of that blank face, then it sort of means maybe they don't fully understand what you're saying. And then you can try a different communication way. So sort of gauge their responses to see if they are truly understanding what's going on. Go ahead and be willing to try any of the variety of communication modes that we've just talked about. Because maybe they'll say, oh, this option is really good. And then another person says, oh, I don't understand it. Do you have this? Do you have X, Y, and Z? You have to sort of be available to go ahead and provide that whiteboard, that pen and paper and whatnot. So it's always good to have a backup. You know, always got to have that plan B. This is pretty self-explanatory, but if you're in a loud environment, if there's a lot of people going on, if there's like cars driving by, something like that, or somebody's talking really loud, it might not help if you start talking even louder. So go ahead and find a more quiet area, a private room, something like that with less background noise. Maintain good eye contact as well, whether you have the mask on or whether they use lip reading or not, just keep that eye contact good and solid. That will sort of let them know that I am communicating with you specifically, or I'm communicating with this person I'm looking at. So that way you can sort of look for clues on their face as well. If they're nodding and they're, scrunching their eyebrows like, yes, okay, I understand. Or if, like I said, if they have that blank face, you can sort of monitor that and say, okay, why do you have that blank face? So I think if anybody had typed up a question, you all may go ahead. One second. Did I miss something in the chat? Okay. Okay, so there were some comments in the chat. Somebody was mentioning that the scuba gear defogging spray works best for defogging the clear mask. Okay. Thank you, Peggy, for that. Are there any more questions from you all? Okay, she asks, have you used the Live Transcribe app? And I have not. I have not used that myself, no. The Live Transcribe, you said. It seems to be good. It may be good to review what somebody said just to make sure everything is, all on the up and up. Are there any more questions? Okay, well, thank you all for joining. Thank you very much. This is not the last opportunity that we will have to provide this workshop. We're going to continue providing workshops. We'll be sharing all the information with you that we have in the coming weeks. So keep a lookout for Deaf Inc. workshops in the coming future. We'll be posting them on Facebook. We'll talk about like communication factors, working with the various communities you work with. And we'll be talking about workshops related to in-person discrimination and things like that. So again, thank you all for your time. Thank you very much for joining. And if any questions pop up later, please just contact me. Again, I work at Deaf Inc. and thank you all for coming. Have a wonderful afternoon. And thank you interpreters as well. Thank you.